name is Andrei Bautista, and today I'll be presenting on how we can navigate the opioid crisis. Here's a little bit about me. I'm an incoming junior from DuPont Manual High School in Louisville, Kentucky. This is my second year at the Global Health Leadership Conference at Johns Hopkins. I play both piano and violin, and I also do research and volunteer in pain clinics in my city. My current plan is to pursue a career in the medical field. Getting started, what are opioids? Johns Hopkins medicine defines opioids as a class of drugs that derive from or mimic natural substances found in the opium poppy plant. These medications work by binding to opioid receptors found throughout the body, such as the brain, spinal cord, gut, and etc. This results in pain signals being blocked from reaching the spinal cord or brain. While opioids are effective in relieving pain, they are not without any side effects and may lead to dependence and addiction. Opioids may pose a risk of developing opioid use disorder. This is because opioids trigger a release of endorphins, which gives a powerful feeling of well-being that lasts a short period of time. When the opioid wears off, the good feeling of the opioids may leave people wanting more and more, resulting in addiction and opioid use disorder. Opioids such as morphine and fentanyl are meant to be used to treat a variety of conditions, including chronic pain, cancer pain, and are used in post-surgical pain and palliative care. However, these opioids come with their own side effects. Side effects can include drowsiness, nausea, euphoria, constipation, and at high doses, they can even slow your breathing to the point where it causes death. However, excess opioids weren't always a problem. In the 1980s, there was a mass fear for opioids and addiction, even among cancer pain patients. This led for the concern for the undertreatment of pain. In the 1990s, opioid use for chronic pain became pushed more among pain specialists until opioids for non-cancer pain became the standard of care. On top of this, in 1996, the American Pain Society aggressively pushed the concept of pain being the fifth vital sign to raise awareness for pain and raise awareness to reduce the likelihood of pain going undertreated. Fast forwarding to 2017, President Trump declared the opioid crisis a national public health crisis, with the CDC declaring overdoses from prescription painkillers an epidemic in 2011. Currently, opiates have become a major public health issue, with 2.5 million people in the US having opioid use disorder in 2021, and only 1 in 5 getting medications to treat it. So how do we navigate the current opioid crisis? Currently in the US, there's enacted policies dedicated to stopping the opioid crisis, specifically the CARA Act in 2015, which is aimed towards the prevention and treatment. Additionally, the FDA made naloxone, a drug to reverse opioid overdose, an over-the-counter medication in 2023 to increase access to treatment. There have also been alternative treatments that have been developed. For example, non-opioid oral medications, including non-steroidal anti-inflammatory drugs, such as ibuprofen, Celebrex, aspirin, and meloxicam, muscle relaxants such as tizanidine or baclofen, and COX inhibitors such as acetaminophen or paracetamol. More interventional treatments have been researched as well, including epidural steroid injections. This procedure involves the injection of anti-inflammatory steroid into the epidural space, close to the area where the pain is being caused. Nerve blocks can also be used to inject medication near a specific nerve or a group of nerves to prevent pain signals from reaching the brain. Although opioid overdose deaths decreased from 84,000 in 2022 to 81,000 in 2023, several states such as Oregon and Washington had an over 27% increase in opioid overdose deaths. To explore potential solutions to our current crisis, we can look at how other countries have successfully tackled similar issues. One notable example is Portugal. In the 1990s, Lisbon was known as the heroin capital of Europe, with 1% of Portugal's population addicted to heroin. However, in 2001, Portugal decriminalized all personal drug use. Instead of incarceration, individuals caught with drugs are referred to a local panel called the Commission for the Dissuasion of Drug Addiction. These 3-person panels typically consist of legal, healthcare, and social work professionals. The commission evaluates whether the individual is addicted and determines the appropriate type of treatment, if any. This system encourages individuals to seek treatment without fear of imprisonment. The model emphasizes humanism, recognizing addiction as an illness requiring health interventions rather than judicial intervention. These policies have been proven effective, as demonstrated when comparing Portugal to a US state with a similarly sized population, such as New Jersey. New Jersey experiences around 3,000 fatal drug overdoses annually, while Portugal only has about 80. Although implementing these policies and support systems at a national scale will be expensive, Implementing them in the hardest hit areas such as Baltimore, Philadelphia, and San Francisco can be a more feasible and impactful approach. By concentrating resources in these regions, we can effectively reduce opioid overdose deaths and improve public health outcomes. In conclusion, opioids are powerful medications used to treat various types of pain, including acute, chronic, and cancer-related pain. While effective, they carry a high risk of addiction and numerous side effects, including the potential for fatal overdose. The history of opioid use and misuse in the US highlights the challenges of balancing pain management with the risks of addiction and overdose. Policies have been enacted in the US, specifically the CARE Act in 2015, with the aim of prevention and treatment. Additionally, the FDA made naloxone over the counter on 2023 to improve availability for those that may need emergent opioid reversal. Despite these efforts, the opioid crisis remains a significant public health issue. Despite these efforts, the opioid crisis remains a significant public health issue. Learning from successful international models, such as Portugal's approach of decriminalization, and focusing on treatment rather than incarceration, can offer valuable insights. Implementing similar strategies in heavily affected areas in the US could lead to meaningful reductions in overdose deaths and improvements in public health. By continuing to develop and refine policies, treatments, and support systems, we can work towards a future where effective pain management does not come at the cost of addiction and overdose. First, I would like to acknowledge the Global Health Leadership Conference at Johns Hopkins for giving me the opportunity to present this topic. I would also like to thank Dr. Noor from the American Society of Interventional Pain Physicians, along with you, the audience, for listening. Here are my citations. And thank you so much for listening. And here's my email, so feel free to reach out if you have any questions.